This will be on the importance of data validation in healthcare. And our presenter for this session is Kentucky REC Quality Improvement Advisor, Brent Doom. He's been with the Kentucky REC for about 2 years and has a background in customer service, quality improvement, data validation, quality metric analysis, and coaching and advising to drive improvements. If you have any questions, enter them in the chat box. And if we have time at the end of the session, Brent will answer them. And if not, we'll get back with you after the end of our event. Take it away, Brent.
All right, good morning, everyone, and thank you for that warm introduction, Catherine. And thank you, Mary, to your presentation on diabetes just a little bit ago. But as Catherine mentioned, my name is Brent Doom, and I will be covering our presentation today on the importance of data validation in healthcare. I don't think we touched on our disclosure a little bit before, but I want to cover it just real quickly. I don't have it on this slide, but just want to mention that all of the information in all of our presentations this morning is up to date and correct, but we do not make any representations or warranties of any kind with respect to the content in any of the presentations today. So as it's mentioned, my name is Brent Doom. And I'm going to be the presenter, of course, for today's session, but I'm just one of our quality improvement experts here at the Kentucky REC. There's a whole host of us ranging on a number of specialized fronts, ranging from across all those services that Brent McCune had mentioned this morning, from Medicaid, PI, telehealth, and many of these folks you'll be hearing from at some point during today's virtual event. But we have Vance Drakeford from PCMH and PCSP, Mary Luvisi, that of course you just heard from, focusing on improvements in patients with diabetes, and then several folks that are spread across multiple fronts. As you can see here on our slide, we've got several of them with us here. So the objectives that we have for today's presentation revolve around answering the question, what truly is data validation? And Mary set us up perfectly to move into this topic. We'll then transition into a handful of foundational steps to carry out that data validation. We'll discuss the importance of ensuring that your data is correct and how data validation is a crucial part of the quality improvement process. And then we'll tie it in together with how it all applies to healthcare. So I've made a promise to everybody. I'm not going to go on a 10-minute tangent about fruits. I'll talk about grapefruits and bananas and avocados another day. But digging into today's presentation, I want to bring out the old adage that you cannot compare apples to oranges. With data validation, it truly does ring truer than ever. When we're comparing apples and oranges, it's hard to compare them because, of course, they're two different things. They're two different fruits, even on a literal level, but it's the same thing whenever you're looking at data validation. You don't want to compare two things that are not just alike. You want to make sure that when you're comparing and level setting between two things, that they're going to be the same. Otherwise, that data validation process isn't going to be effective and your results are going to be skewed every time. So say you want to compare two different quality measures or two different ways of measuring that quality measure. They're not going to be consistent because they're going to differ in how they were captured or how they were viewed each time you try to validate them. So here on this slide, I want to cover the what's and whys of data validation. So data validation is the act of checking your data for accuracy and or compliance with applicable standards, rules, and or conventions. It's also any process that's used to flag inaccurate, incomplete, or unreasonable data throughout that process. And then here on the right side of this slide, it can provide us with some context as to why we do this. The answer being that we want to verify and validate our data and processes, but some questions to keep in mind, and we'll kind of follow a very similar fashion with this, some questions to keep in mind as you're validating your data. But when you're verifying and carrying out that verification process, you can ask yourself, are you pulling the correct report? Is it the report that's going to accomplish what you are setting out to accomplish? Are you using the correct measurement period? And then likewise, some questions to keep in mind for the validation processes are, is your EHR pulling the correct information into your numerator or denominator? Are the fields within your EHR tracking to give you the credit that you're needing to get credit for? And then lastly, is everyone on your team trained to enter data into the appropriate fields so that those EHR fields are, of course, feeding into your numerator and denominator properly? In starting with this data validation process, of course, you may be asking, where do I start? I've never done this before. So the answer to that is the baseline data. Initially, right off the bat, you want to determine your measurement period. That might be a full year or 365 days. Say we're talking about quality for the quality payment program. It could be simply 90 days if, say, we're looking at promoting interoperability, or maybe it's just a month. In establishing that baseline data, you'll want to establish the way in which you're going to calculate your current rate. You could utilize measurement approaches that have been provided by NQF or the National Quality Forum, or UDS, the Uniform Data System. And when looking at the different ways to calculate your current rate, it really helps to see where you are, and this aids you in setting a realistic goal. Essentially, establishing a baseline data plays a huge role in setting the stage of where you're wanting to go. Oftentimes, we like to use a SMART goal format. And for those of you that are not familiar with that format or unaware, SMART is an acronym for specific, measurable, attainable, realistic, and time-based. And in following that format, you're able to set goals that are more realistic to obtain, as opposed to setting a goal that might be a stretch. Even though many of us, I'm sure, enjoy a challenge from time to time, we want to make sure that we're setting goals that we can truly obtain. And then lastly, we want to ensure that we are consistently measuring with the same measure type, which ties back to the methods to calculate, keeping it consistent. And again, on the right-hand side of the slide, some questions to consider when working towards your baseline data. What measure are you validating? And why are you going to validate that measure? What method are you using to pull the baseline report? And how is the report structured? Consistency is truly the key. So constantly asking yourself these questions and repeating the same process throughout is the overall goal. Mary mentioned previously that this is an ongoing process. You don't do it once and it's done. You continuously have to go through this data validation process to ensure that your data is accurate. Now, as far as a foundation in data validation, we want to review the specification sheets. The spec sheets are a key tool to have in your toolkit in any quality improvement project. I know that oftentimes quality improvement screams quality measures alone, but there are spec sheets for promoting interoperability, also known formerly meaningful use, those measures and such too. These specification sheets will explain the patient population, the numerator and the group that falls into that number, that denominator and the group that falls into that, and then any exclusions that may be applicable to the measure that you're taking a look at, that spec sheet. So the first step to take in reviewing those spec sheets is to begin with the originating body spec sheet. And since our next session is the quality payment program, I'm of course referring to that to set the stage for our next session. But as we look at that originating body, those spec sheets would be from CMS, of course, the Centers for Medicare and Medicaid Services. And in understanding those spec sheets and the measure itself, we have an example here for controlling high blood pressure. We can see our measure description right there, right off the bat, to tell us what we are looking at with this particular measure. Next, we see that initial patient population, which I will say that in many cases, your denominator will be equal to your initial population. And then when this is applicable, your denominator will say, as we see here, that equals initial population. Next, we have those denominator exclusions. And to any of the patients that may fall into that patient population, but are also applicable to some of those exclusions, then they're going to be excluded from your denominator and excluded from being measured under this specific measure as a whole. And then lastly, on the numerator side of things, we have those patients that are within the initial patient population that are meeting the numerator requirements as established for having controlled high blood pressure. And so when we're looking at the spec sheets, these are the kinds of things that we want to look at in validating our data. So how do we validate our data now? We've established our methods, we've reviewed the spec sheets, and what's next? So now we want to run our baseline data report. And this is going to tell us our current standing to date. And from this report, we can then carry out a systematic sample chart audit to just spot check the data that's being pulled into that report. And then when doing this, look at the data truly as patients and not just numbers, because those patients hold so much more of a story and than numbers on a page, and they are truly why we do quality improvement. We want to improve their overall health. We want to improve the processes and what we do to take care of them. Ask yourself, what is that data telling you? How can you better serve that patient? Does the data seem accurate given your patient population? So you're going to be drilling down into those numerators and denominators to verify, to see if the data truly looks accurate to the work being done in your clinic or organization. This allows you to identify any discrepancies, whether they be with vendors or workflows. And after all, each of you are truly the largest, most familiar expert with your own organizations. So this brings us to our first polling question of the day. The poll should pop right up on your screen or within your Zoom window. And what we would like to know, just a quick yes, no question, is if you monitor your data monthly. And I'll just give a few moments for you all to participate and answer the poll. I know it's still a little bit early for even us folks here in the Eastern time zone, a little bit earlier for those of you in the Central time. But we want to get a little interaction in this morning, so we'll just give you all a few more moments to get those in. It looks like for the most part, the large majority does monitor their data monthly. And so we'll go ahead and close that poll out. I appreciate you all participating in that. It's great to just have that feedback as we go through our presentations. For those of you that may or may not consistently monitor monthly data, here on this slide, I want to discuss why it can be so important and impactful to do so. And maybe for those that already are monitoring monthly data, maybe I hope some of this is found to be helpful to you all. Again, we want to keep that consistent. We want to keep our monthly data consistent. Again, we talked about the apples and oranges at the very beginning. And that monthly data is no different. We want each month to be able to be compared and lined up against each other. So we want it to be the same. One approach to displaying this data is to generate a monthly report. For example, a January report showing the data from the 1st of the month through the 31st. And by doing these monthly reports, we're able to include any year-to-date progress to show how we've moved the needle across the year thus far. And as you begin to expand this data over time, you have the ability to trend it or graph it out. And by doing so, we're able to ask ourselves, have there been any significant jumps? And what is the data telling us? Did we test something new or update our workflows during some of these changes throughout the month? And the good news is whether it is a good or bad test of change, or maybe it was a workflow update, we can call that out on our chart to signify that sudden increase or decrease in performance, because our tests of change are going to mirror, whether they're good or bad, they're going to mirror our performance. And so that takes us to our next slide. So tools to track data. And now that we have all of this data, validated it and verified it, we're utilizing our capabilities to generate monthly data. How do we track it? I started talking about charting data with our last slide, so I'm going to pick it back up there. We're able to generate line charts that will help us recognize trends of 5 or more data points in either direction. And one method that I will speak about more in the upcoming slides is our PDSA tracking sheets. Mary touched on it in her presentation. So again, just building on each other. And a PDSA approach will really help as you begin with a small test and plan to spread it across more service lines, patients, providers, or whichever may be most applicable to your test. And then lastly, be sure to share data throughout your organization. Be transparent. This will increase buy-in and will help your team to understand the overall goal and where you currently stand in working towards achieving that. Additionally, on this right hand of the slide, we have some key benefits that come from tracking your data. You're able to work and use the data to evaluate and drive change. You can work backwards to resolve workflow issues after a problem is detected, and you're able to document when and what interventions are being tested on your charts. So signifying whether it was a positive performance increase or a negative performance decrease. So I know at this point, we've talked about several different aspects of data validation. And so I want to turn towards applying it to quality improvement in healthcare. As you can see on this slide, HRSA defines quality improvement as systematic and continuous actions that lead to measurable improvement in healthcare services and the health status of targeted patient groups. We believe this is truly such a fitting definition for quality improvement. And so we have a second polling question this morning for you all. And again, that poll should pop up. And what we would like to know now is, do you have a preferred quality improvement method in your practice? And just a quick yes, no question. So we'll give just a few moments to read through and answer. It may be PDSA, or of course, there are any number of other methods that you may utilize in your practice. And thank you all for participating in the polls. It's good to see that you all are awake and moving about this morning. All right, so we'll just give a few more moments on that. Looks like the large majority does have a preferred quality improvement method. All right, so for those of you that do, maybe you don't utilize a PDSA, and for those of you that don't, the methodology that I want to discuss today is the PDSA. IHI emphasizes this methodology, and it's one that's really simple, easy to implement, and has a great impact for driving improvement. In fact, most of us have used this without even realizing it. Do you remember whenever we were commuting to the office every day? It's been a while, I know. But typically, you were probably trying to figure out, how do I get my coffee, or how do I get the kids to school? How do I get to work on time the fastest? If I'm running behind, what's the quickest route? And so naturally, you were doing a PDSA to be able to figure out, how do I get to work? How do I get what I need to get done? So with a PDSA, there are 4 steps. Step 1 is to plan. So plan a test or an observation and make a plan for creating or collecting your data. Establish your baseline, set your goals, and that timeline in which you want to shoot to test this test on. The second step is do. So actually carry out and execute your small test. Document any problems or observations that you hit along the way, and don't forget to document your successes. Even if they're small successes, small wins are worth celebrating. So always celebrate even the smallest of successes and document those as you go along. Your third step is to study. So actually set time aside to study the data and the results, and then compare those data points to what you had initially predicted. How did it align? How did it differ? And then the last step is to act. So this is where you're going to adopt, adapt, or abandon. And some of this verbiage may sound very familiar for those of you that have heard about the PDSA cycle before. So adopting would be when the test, when it went great as executed, and you're wanting to roll it out to more people. Adapting would be that it went pretty well, but it could be better if. So you would try to find out what that if is. And then lastly, that abandoning, this is where that test of change did not go well, or maybe your staff just didn't receive the change well, in which case you would abandon that test of change. With each way of acting, simply determine what modifications should be made and plan for the next test. In tracking your outcomes, you can utilize a PDSA cycle form, which on our next slide, I will show you all an example of one. You will also want to remember how important negative outcomes can be. It's okay to fail. Those negative outcomes can be just as useful as positive outcomes because you're going to continuously be learning about how to improve. And of course, not every intervention will work. Not every shoe is going to fit. What works for one clinic or organization may not work for your clinic and organization. So you have to discover what does work well and what may work better. When you do have a series of positive outcomes, as Mary mentioned, begin spreading those positive changes throughout your organization. And by doing so, you will generate even more positive outcomes, which will in turn provide your organization or your clinic with sustainability. As I promised, here's a brief example of a PDSA sprint. And I want to walk you through the process real quick for those of you that may not be as familiar. We advise each of you to start small. So, as Mary mentioned, it could be one patient for one doctor on one particular day. And then as you continue to expand it, as positive outcomes allow, as you plan your improvement, be sure that you're documenting the responsibilities of the what, the how, the who, and the why. Um, and make sure that everybody knows how it's going to be executed. When studying the results, ask yourself why the test worked, if it did. If it didn't, why did it not? Did you notice any unintended impacts from your test? Because while we're trying to improve one thing, sometimes we can inadvertently negatively impact another. And lastly, what can you do to improve in your next test or PDSA? Just a few things to remember as we round out our session on data validation. You want to start by choosing your methodology. You want to how you will be consistent in measuring and tracking and monitoring your data and your improvements. Be sure to engage and communicate with your teams, patients, and peers as you implement data validation and quality improvement processes, because your frontline staff, um, again, it ties back to Mary's point of bringing in ideas and getting their opinions, because they're the ones dealing with it on the front end of things. Sometimes, if you're on the back end, you might completely overlook an aspect that really could draw a lot of positive change and positive outcomes. So create a plan that works for everyone and stick to it. Again, keeping things consistent. Remember that it is okay to fail, because you're still going to learn from those failures, and they will help you as you move forward in your future tests. And then lastly, I've said it several times, but once again, keep it simple. Do not overcomplicate anything. So there's no time better than now to begin improving the workflows of your clinic or organization and working to provide a higher quality care to your patients. Those patients tell a huge story. And I know each of you are wanting to improve their overall quality of care, the care that you provide, and their quality of life that they're living. We highly recommend and advise that you begin today by keeping it simple, asking questions, utilizing your data, and know that every baby step truly helps. And all you have to do is try. As we round out the presentation today, I want to let you all know of some opportunities in which the Kentucky REC can assist you on the frontier of data validation and quality improvement. So I mentioned it's not just me. We do have a whole host of certified experts to provide education and personalized support for you all as we serve as a trusted advisor to you all as healthcare organizations, clinicians, and leaders to help you all manage that complex and changing world of healthcare. As far as quality improvement support and coaching, we offer it in two different forms. One being as a contract enhancement or add-on, if you will, which provides you the opportunity to have the addition placed on your QPP individualized assistance for those of you that are already currently working with us. And then on the other hand, you could have that add-on added on to your PCMH or PCSP contract. So that would be that contract enhancement. And then on the other hand, if you're looking for more of a traditional quality improvement focus, we can provide foundational education and individualized assistance project support on that aspect. So before I pass this off, I want to give you all an opportunity to submit any questions that you may have in these last few moments. The chat feature, if you haven't utilized it thus far this morning, it should be somewhere at the bottom of your screen today. And then, as Brent mentioned, I'll just touch on this briefly, but our contact information is here on our slide. We're on all sorts of social media pages and everything, but we would love to hear from you. We are here to help you. So do not hesitate to reach out with your questions concerning any of our services. As mentioned before, we have a whole host of us here that are willing to help each of you. And then without further ado, I'm going to turn it back over to Catherine to take us from here. And just thank you all for joining us for this morning's session. Catherine?
Thank you, Brent. Really appreciate it. As you can see, um, our contact information is up on the screen. You can email us or give us a call. And we also have our Facebook, LinkedIn, and Twitter accounts to check on for. We post upcoming events, we post big regulatory changes, anything that affects you in healthcare information technology. And if you do have any questions, I know someone asked about slides. We're actually recording these events, so it won't be separate slides, it'll be the recordings. And just contact us and we will share those with you. We also have a YouTube account, so you can look up videos from YouTube. And we actually have a minute, Brent, if I could ask you a question. I'd like to know, what did you say that acronym for goal setting is?
So I think you're referring to the acronym for SMART. So that SMART acronym, it stands for specific, measurable, attainable, realistic, and time-based. So it's a very good template for ensuring that your goals are within range of successfully attaining. The one being specific, be detail oriented when writing this. So be specific of what you want to, what that goal, what you want to accomplish. Measurable, be sure that it's data driven, whether it's a quality measure of current performance to where you want to go, or whatever, however you're going to measure it, be sure that you're able to have it be driven by data. Attainable is, can you actually attain this goal? Is it realistic? Which leads me into that R. And then that time-based kind of wraps it all together. Are you able to measure your specific goal and attain it in a realistic fashion within the time frame that's been established?
Great, thank you. I think that's really helpful information for everyone to have.